be made about home-based television in America. Na Medicaid one must say bidding common afa a pan who do a bit me afa swabwa ye who COVID-19 kwa ye queen enti ye no be food high in between common. Dr. Rashid Salwat ono anything really in between common now watch ya kwine wono at the Salwat Health Restoration Hospital anwa wono eye dwumason e de abo man Ghana na ye behwe dwumedi odi wo hono mankasa na e kwan so a ewo nindie mu obetimi afaso amomanga ne nia etimi akon etia COVID-19 no enti we de sinkonya na pass tie komo aye ba betwi fise menu mienu nia ebebo aye nipa yewura no ne potokasa ne hyedanye enti no eni ne twi kasa no na enye enti ye be potokakra na ememu na meso be chirechiremu kakra e de amanti. Doctor, good evening and welcome to Mr.
Thank you very much.
It's an honor to have you this evening.
I'm very privileged to be here. To be here with you, and I say good evening to your viewers.
So let's start with what you do at Salwat Health Restoration Hospital. What exactly is it? An alternative medicine, or is the normal treatment you give to people?
Yeah, Salwat Health Restoration Hospital is a hospital that we tackle ailments and illnesses by two means, the physical and the spiritual. The physical ailments, like any other physical ailments, when they come, we take it outside and make sure that we give them the treatment, the ailments. We will get rid of the ailments. And then when it is not also a physical problem, it's a spiritual problem, we'll deal with it as a spiritual problem. We have machines and other things, not machines actually, like some kind of a diagnostic system that can diagnose.
But can you please add a little projection in your voice so that viewers can hear you clearly?
Okay, thank you. Yes, so we have some of our doctors that can do three things at the same time. For instance, when you go in there, they put something which we have designed, and it's a kind of technology. It's also we have studied frequencies, and it will remit frequencies for us to know the type of problems that one has, and that will mean that they have to put down the port of scanner screen and lab test at the same time. So it is 100% physical. So we'll go ahead, and then at the same time, as it talks of the ailments and the same technology, prescribed medicines, so that the doctor will just write down the prescription of the medicines that will actually be good, so that when you take it, you get your health restored back. And when it is spiritual, then we take it aside and we have remedies for spirituality, so that you can often hear from people who say that they have been to hospitals and they have been to other places, many health centers, and they haven't actually got a respite. They haven't actually been cured from their ailments. Now, but they will say that they have gone through all the lab tests and they have found nothing wrong with them. And when they come to our place, sometimes it will be a spiritual problem.
Okay.
So we'll look at it, and at the same time that we'll find out that it's a spiritual problem, our screens will also prescribe the requisite medicine that the person will take, and then will get himself delivered.
Okay. Because we are hard pressed for time, I would go back to what you do.
Yeah.
But let's talk about COVID and how much belief you have in the technological way of fighting this COVID. You've had conversations. I mean, we had a little conversation behind before we went on screen that you believe we could use technology to, if not eradicate COVID-19, we can just suppress it. How do you think we can achieve
Yes, first and foremost, if someone contracted the disease, the testing, if the person goes for a testing, they take it to the laboratory. That's technology. And then you cannot see it with your naked eyes. You can only see it through the lens of a microscope. And this is technology in the first place to either see whether the person is positive or negative to COVID-19. Now, at the same time, everything in the universe vibrates, and the vibration of everything actually is transmitted or converted into frequencies. We can measure the frequencies of COVID-19, the virus. We can measure how the virus behaves. We can measure it. It's a way of actually using technology to measure the damage it can do to the body. Also, we can measure the extent of how fast it can deteriorate the body, so that we can seize it by just using frequencies, because the virus itself is using a frequency, and we can counter the frequencies of the virus. So we can actually work in hand, if we are given the permission, to stop COVID-19, to eradicate completely COVID-19, because it is a virus that can really be measured, and it is a virus that we can go ahead and make sure that, yes. Now, in our hospital, the Salwat Health Restoration Hospital, as the name suggests, is to restore the health of people. Yes, COVID-19 is real. There's no two ways about that. It's real. It kills. It is a very deadly disease, virus. Now, so we also add our voices to those who are campaigning to maintain the protocol of COVID-19. We sanitize people, and at the same time we tell them to keep the distancing, social distancing. You stretch your arm, and he stretches his arm, and when your hands don't meet, that is the distance in which you can stand and talk to each other. Now, so we tell people we admonish people to be hygienic, to be to wash their hands in the flowing water with soap, and also to sanitize their hands with sanitizers that has an alcoholic base, chemicals. So we help in the campaign, to eradicate COVID-19.
Okay, you speak with some precision.
Yes.
Like, have you tried the technological way of measuring the way the virus behaves? Is it something that it's already done at Salwat that you speak so much with precision about?
Of course. We have at the dawn of the insurgency of the virus, we didn't sit down to say that there's virus coming, what can we do? We are going to defend. No, we didn't sit down. As a matter of fact, as a hospital, and we can actually conduct researches. We have done a lot of researches based upon the information available, and also we have done researches of how the virus behaves in the human body. Now, to say that we could just sit down and do nothing about COVID-19, then that is not actually Salwat Health Restoration Hospital. So we have actually gone, the extra mile to know how we can protect ourselves and protect people from contracting the disease. Yes, and possibly, if we are given the chance to come out with remedies, yeah, we can do it. But the thing is that we all know the remedies or the medication for COVID-19. It is the WHO that really set the pace, and the government, no government would like to go against the protocol of COVID-19, which has been set by the WHO, and all our government too. We don't want where we will become lawless people. No. In the Salawat Health Restoration Hospital, we will make sure that we will obey the law to the letter. Nobody, as an alternative practitioner, nobody is given the go ahead to treat COVID-19 in Ghana. No. So we will just stop there. But we are not ignorant about the disease, the virus.
Okay. So have you made moves? I remember, I think late last year, I had conversations with other alternative medicine practitioners, and they were angered by the fact that they've provided the FDA with samples of drugs that they feel would help cure the virus, but it's not been passed yet. Have you made those moves? Have you told them about your discoveries?
No, we haven't. The only move that we did was to contribute some. They said anybody who would have a remedy for COVID-19 in a hospital, they can bring it out for FDA. Our samples have been there, but we don't take it there ourselves. It was collected there, and then we know that they wouldn't say anything about that until now that they have come out to say that Mampong Scientific Research Center should do a clinical practice or observation about some herbs that they think can fight COVID-19. We agree with them 100%, because we might be very careful, and we might be very go about the rules and regulations of FDA, but there are a lot of others who don't care, and they will, instead of making sure that your medicines are safe, they don't care about that. We care because safety, our clients, we make sure that they are safe and they are secured and they are happy. And integrity is our landmark: integrity and trust. So we make sure that we don't have problem with going to FDA to say, look, FDA, we have these medicines, so give us the license or give us a certificate. We don't know, because the government is not there yet.
So let's just create this scenario. If the government says that, okay, at Salwat, whatever you've done, they believe in it and they want you to produce on the mass, because usually when these things come, they look at how the quantity the entity can provide. So if it's that, okay, we accept whatever you have, but do it in a mass production, do you have the capacity to produce?
We have the capacity. At least if you do it and you pass the know-how to the government can do it in a large scale. It will take very, very, very few days to get to the quantity that the Ghanaians will need. Yeah, we are ready. We are told to do anything. Yes, we don't do that.
Sometimes we know in the West you can find like 2-3 practitioners coming together because they say the voice of the people is the voice of God. When there are masses who believe in one cause and are fighting for it, they are forced to listen. Do you see Salwat coming together with other people to push this agenda? That's okay, this is what we have and we believe in it, and so that the other people come about, because it's not just Salwat who is pushing for the government to pass whatever they have, believing that it can cure or can help in suppressing the COVID virus. So would there be a day that most of you hospitals will come together and say that this is one agenda we are pushing, so government should listen to us?
Yeah, we are actually waiting for the Lampong Scientific Research Institute to, when they are passed, to be very, very potential in the fight of COVID-19. I think we will call on board and we will partner them, or if they seek our, seek our partnership or seek anything that we can offer in addition to that, because that is the alternative side of medicine. Actually, it's only in West Africa and other places in the alternative medicine is very expensive outside the country. In America, in Europe and America and other places, alternative medicine is very, very expensive. Now, so we would like to do that, but we say we wouldn't want to be seen as people who want to break the law. No, we want to really maintain the law. I have a military background. I was a soldier before. I was commissioned into the Ghana Armed Forces. I have a disciplined background. I'm a disciplined person, and I make sure that I obey the law. It doesn't really talk well about somebody who has gone through this strenuous training to instill in himself discipline, to be a lawbreaker. No, it doesn't talk about you well. So we in Salawat Health Residential Hospital, we are bound to obey the law to the letter and make sure that there is order in everything, order in the medical industry and order in the alternative medical industry.
Okay, so what's the one thing that Salwat has that can convince people to believe that, okay, this is it, this is the hospital that if we need to get cured of an illness, we should turn to Salwat?
Right. Now, we have gone the extra mile to delve deep into human dynamics. And by saying that human dynamics, we have studied the body, the human body. Obviously, in medicine you will study anatomy, and you will study parts of the human body and also their functions. We have gone beyond that to also find out the frequencies of the various organs that we have in our bodies. For instance, the heart has its frequency. The stomach has its frequency. The liver, the kidney, the pancreas, whatever, they all have their frequencies. So what we do at Salwat Health Research Hospital differently is that we give marks, either plus or minus, to a particular organ. If the organ does not actually meet the requisite requirement and it does not fulfill the frequency of a healthy organ, we can know, and we will know how much is left to make it up. So we diagnose upon this kind of knowledge, and we haven't been found wanting. So if you come to Salwat Health Research Hospital, we never ask you what brings you here. No. You sit down, we do the talking and you do the listening. Giving you certain things to hold, some cases to hold and other things. We'll tell you, this day you had this headache and you are suffering from diabetes, or you have hypertension, and there are a lot of cholesterol in your body. And we would rather tell our patient what it is, and it's up to our patient to confirm or deny what the information we are giving to our client. Our clients will say yes. No, you don't sleep at night. You say yes. You sometimes wake up at 2 a.m. and you never get a sleep again. You say yes. 2 weeks ago, this is what you were feeling. You have acute stomach pain. You say yes. And that's what we do differently in the Salwat Health Restoration Hospital. So that just convince people that if you come to Salwat Health Restoration Hospital, you are coming to a place whereby you are welcomed, you are in good hands, and you are rest assured that we will maintain our integrity, and so that we will give you the correct diagnosis and also medication, that when you go and you are happy, you have trust in us. And that is actually our reason.
Okay. So there are so many other alternative hospitals that mention that we help cure so many diseases, but this is our expertise. I don't know if Salwat, you have anything like that okay, we can help cure so many illnesses, but this, if you come, surely you won't go back with this illness. Do you have any specialty?
We since we are dealing with frequencies and we know the frequencies of each organ, we can assure you that we will know, and we can assure you it might take time. We will be able also to tell you that it might take time for you to be fully restored to your normal health conditions.
Okay.
Yes.
So there is nothing like, as for this illness we are special. There's nothing like
that. We have blended together so many things, right? Because you come, we go through the physical, they take your vitals, then you go through the physical examination. Not that you take off anything that you have worn. No. Your clothing are intact, and then we can find out everything from you and know your problem. And if it is physical, as I said, we will treat it as such. And if it is spiritual, we treat it as such. But how many places that we will go at a point in time, and at a certain in time, they can be able to diagnose you if you have spiritual problem. But we would do that. I say your problem is a spiritual problem, and this is the what happened, and this is the time that you have this problem.
Okay, so very soon we'll have to end this conversation, but just a little on the COVID issue again.
Yeah.
Would you be disappointed if COVID persists for a while and we are still using the Western vaccines to combat it, and it happens that one day COVID becomes a norm with us, it never goes away, and no African, as a matter of fact, a Ghanaian, was able to contribute to battling the COVID-19? Would you be disappointed?
I will be very, very much disappointed. We Africans have the knowledge and we have the know-how, and we can do very much if we are given the level field, and if we are given the permission to do, we will do wonders. Now, we are working on a project. This project is that for a client to just step into the consultant room. We have a camera. We are on that project here. The project hasn't finished. We haven't finished the project yet. That the camera will zoom on you, then scan you, and will tell us, will remit all that your problems are onto our screens, and I will be able to know, we'll be able to be very precise that you have this problem with your heart, and this is the medication for it. You have this problem with your heart, and this medication will not work. You have problems with your liver, and this is the medicines that can work properly for your liver. And we'll be able to calculate the days that when we take this medication for this number of times at this rate, you should be assured that in this number of days you will be cured. I'll be very, very disappointed if the alternative medicine industry is not invited to fight COVID-19. That we should be invited to not only campaign, add our voices to the maintaining the protocol of keeping our distance, social distancing and other things, but to physically bring up certain things that will help eradicate the virus completely. I mean, anything that has a beginning has an end. Nobody had COVID-19 10 years ago. No. I mean, COVID-19 has a beginning, and it should have an end. Everything that has a beginning should have an end. Yes.
Do you think, away from COVID, do you think that alternative medicine practitioners have, you have a seat at the table when it comes to, medicine and, curing? Do you think that as a state or a country, do you think that we're giving you the right seat at the table when it comes to?
Not yet.
Okay.
Very, very disappointing. Not yet. We are under TCMP, traditional medicine, and traditional medicine council. We are under them, and we will not want to do anything outside their scope. under the umbrella of the council. So we always have business with the council. The council itself has difficulty in putting across even some of the problems, the day-to-day running of the council.
Right.
We have a problem with that. Now, sometimes someone will look at it and this is, an alternative medical doctor. Because we think that the orthodox medicine or orthodox way of treating cases is the best. Well, that is an opinion expressed by somebody. But I think differently. And I had wanted that if the council, the traditional medical council, could be given the same status as other branch of the medical industry, I think we'll do lots and lots of things for Ghanaians. Especially that nowadays we have so many ailments that we did not experience them before. You see somebody who gets about 20 something and he has prostate enlargement. And we all know that it is only when you cross 50. In the olden days, when you cross 50 that you get prostate enlargement. No, very young men have started having prostate enlargement. That means that there's something wrong in the system. There's something wrong in the food that we are eating. And perhaps we are not eating the correct way of eating. We don't know the correct way of eating. For instance, I'll just give you one example. If you want to eat meat and food, you first eat the meat first and then eat the food. Because if you eat the food and eat the meat later, it will ferment in your body. Likewise, when you finish eating the food and you take fruits, it will ferment in your body. It will ferment in your stomach, and that will actually give you gases. So we don't even know how to eat. I mean, so you see that a young man, very young person, about the age of 30, will have a high blood pressure problem. What is actually, there's something wrong in the system. So we should come out with not only treatment. The saying goes that prevention is better than cure. We should work out a way of letting people to be prevented from contracting certain ailments.
So what is preventing you from having a seat at the table? Is it because, obviously it's not because of numbers, because I know that there are so many of you, but is it because you are not loud enough?
Well, we have been enacted by the law, by Parliament, yes. And then I'm not one of the executive members of the council. I'm under the umbrella of the council, and I've been supervised by the council. So I will not teach the council what they should do. No, it will not be this. I can suggest. Right, I can suggest. But I think that the council should be actually brought up. The government should allow the council to come and say certain things that they think that would help the council, so that the council will grow from strength to strength. And by doing that, we are complementary. We are complementing the effort of the orthodox medicine.
Right.
Yes.
Okay. So unfortunately, our time is
okay.
up. So I don't know if there's anything that you want to add to the conversation before we just wrap up.
Yes. What I will say is that there are so many things that we can do as Ghanaians there are a lot of things that we can do. We can help in the campaign of other ailments and others, so that Ghanaians will get rid of them. And my advice is that, as the saying goes, prevention is better than cure. Prevent yourself. Make sure that you eat well and you eat organic food, and make sure that you eat very well cooked food, not junk food. The difference between you eating pure organic food and someone eating junk food, the person might be very, very vulnerable to other ailments. But you who is taking organic food, your immune system will listen. We have an inbuilt system in us, mechanism in us. That's the immune system. The immune system is boosted when you eat very, very pure, organic, and natural things. So I would say that Ghanaians, let us look at cultivating, organic fruits and organic vegetables and organic things that will help the Ghanaian to be able to be very, very industrious and self-sufficient, because a healthy person means a healthy society, and a healthy society means a healthy nation.
Thank you very much, Dr. Rashid Salwat, for gazing our show today.
Okay.
In commodity, no, I have any BBC na Mjidi said, Niama Rodona and Wittimisia and Energy. Yeah, she knows about no Subitua and say alternative medicine. I want to study in Liverpool, no Musumwa, now on my Yapumudin sent into me engine. And Dr. Rashid Salwat and a drink Komono at Salwat Health Restoration Hospital. And any drink Komono. Casiabono in Yankuni, Yamumesu Hasiaba, Yaba, Yadri.